The role of social media at a meeting like ASCO is still yet, I would suggest, untapped, but it's growing. When we think about the impact of social media, I would suggest that it can infiltrate all aspects of a meeting like this. What I mean by that is that researchers, patients, clinicians, the pharmaceutical industry, really anyone interested in what's going on here can have a greater experience of what happens here through social media. So many people, probably tens of thousands of people who wish they could be here in Chicago for the meeting, can in a sense be here. And they could have before with online broadcasting and so on, but through social media we have a deeper understanding of what happens here. So not only can the data be presented, but people can give interpretations of the data and their commentary on it. And some would argue then people can give a skewed view, but we value peer review. And this is the broadest sense of peer review. I'll sometimes say if someone presents an abstract like Dr. Palumbo did yesterday, he may be able to entertain one or two questions for sake of time. Well, now literally thousands of questions can be entertained through social media, whether it's being tweeted out or blogged out. I was even blogging yesterday trying to give my interpretation of not only the data that was presented, but what it might mean for the myeloma community. And that instant and broad dissemination of information is really, I think, critical for us in the oncology community, and being able to promote that through a meeting like this, I think is ultimately going to benefit all those involved, and in particular our patients at the end of the day. I think it actually changes the discussion for the better, because the reality is when I go into my clinic tomorrow and see patients, I have a discussion with them. And they have to interpret the data for themselves and decide, is this a treatment I want to go for or not? Although in a sense we order drugs for patients, it's a partnership with them. So there are those who might fear that there may be a skewing of the information by those who aren't as familiar with the disease, and that's understandable. But in our experience, these are educated individuals who are wanting to know, and they're pushing us in a way to help us understand the patient's perspective of these new advances. So I applaud it, and I think actually at the end of the day it'll bring real life information to our patients and to our clinics.